What's up, everybody? Dr. Lance Robbins here with iTooth Family Dentistry. Welcome to another episode of Fireplace Fridays. Today I want to talk about diagnosis, and not just complete diagnosis, but proper diagnosis. I want to share with you a couple of cases that happened just this last week. I got a phone call from my wife last Thursday night, and she said, so-and-so is having a lot of pain. They were diagnosed with a fractured tooth, and they can't get into the oral surgeon until the second week of August. And that was almost a month away. She asked, can you look at her, see if maybe it's something that you can do and help them out? So I said, sure, have them come over. We took an x-ray on Friday. And while we were focusing on the tooth that was diagnosed, my attention was drawn to the tooth in front of that was obviously abscessed. And when I pointed that out to this person, they said, well, I told them that I thought it was the tooth in front. That's the one that hurts. And you can get referred pain. We have patients say it's this tooth, and sometimes it is, and sometimes it's not. So we want to make sure that when we treat a tooth, it's the right tooth. And before we had our 3D machine, I was very frustrated with the lack of certainty that we would have at some of those appointments. Patient says, this tooth hurts, you can't see anything on an x-ray, there's no abscess, there's no cavity, can't tell if there's a fracture. And so when we started using the 3D machine, and we would take the 2D x-ray and not be able to see anything, we would go to the 3D and verify tooth and diagnosis. And that has been wonderful for especially emergency cases where the patient's either not sure what the tooth is or can't completely describe or pinpoint the symptoms. And so there are a lot of abscesses out there that are undiagnosed or unknown to patients, and some of that's the way that x-rays are being taken. Typical offices that take the intraoral bite wing x-rays are missing diagnosis. And if you compare that to the x-rays that we take, as you can see here on the screen, we can see not only the bite wing x-ray where we want to look at the contacts between the teeth, but we can also see the roots of those teeth and the apices and give us a better idea if there's something going on. And then if we can't really diagnose from the two-dimensional x-ray, then we go to the 3D and verify diagnosis. So we diagnosed tooth number 4 with an abscess, needs a root canal and a crown. And for the weekend, this patient had been to their other dentist, and there was nothing given for inflammation, infection, or pain. So we managed those for the weekend, the infection portion, the inflammation portion, and the pain portion. And by Saturday evening, that patient was feeling much better. By Monday, they felt pretty good, no real symptoms at that point, and we did a root canal and a crown and got them back to health, at least on that tooth. Now, with the 3D image that was taken, I was able to look at some other teeth and found another abscess. And I brought that up to this person, and they said, well, it feels different, but it doesn't hurt. And it's pretty obvious why. When we lifted up the cheek and looked, you could see the fistula that was there. And so that abscess was draining, so not building up pressure and causing pain. And so, again, another, this goes back to complete diagnosis, not necessarily proper diagnosis, but it was missed. And by the size of the infection, it's been going on for some time. So again, back to those bite wing x-rays where we're only seeing a little bit of the bone and the crown of the tooth and the contacts in between those teeth. And so that was missed as well. So that will be our next course of action. Another case, we had a patient that went to a specialist, had a root canal done several years ago. That tooth started to have some symptoms. And so they returned to that doctor, and we're not real pleased with the results and the lack of thoroughness in the exam and diagnosis. So the bottom line was they were told that it's the tooth below and that tooth needs a root canal. Well, patient returned to us and we took some x-rays, we discussed symptoms, we did some diagnostic testing in the operatory and isolated the problem. We did take a 3D x-ray, and the patient is having a lot of sinus problems as well. So before we jump back into treatment on this tooth, we are going to verify with their primary care physician or ear, nose, and throat, whoever they're seeing, and rule out the sinus infection, and then proceed with our treatment. So we get back to emergency type situations and being able to properly diagnose and completely diagnose what's going on with patients and their teeth, and then getting a course of action that doesn't harm or hinder them in the future. You know, the first case, you would hope that the oral surgeons would have looked at that and said, I don't think it's this tooth, I think it's the tooth in front. And hopefully they would have done that. But had they not, and they extracted that tooth, and then the patient still had symptoms because the tooth in front of it was abscessed, and who knows how long that would have taken. Now we may have lost 2 teeth. And so proper diagnosis is very important, and complete diagnosis is very important. Now, nobody's perfect, and can we miss things, or can we not maybe diagnose something that is there? Sure, that happens. And I'm not here to bash other dentists, but I think that if we're only taking intraoral bite wings, we're missing things. So I hope this information helped. If nothing else, it gives you an opportunity to look at how your dentist is diagnosing and look at the technology that they're using. Our patients love our extraoral x-ray machine because you just bite on the stick and the camera head goes around outside of the head. It's a lot more comfortable. Every once in a while we do take an intraoral with this sensor that is not so comfortable. But for the most part, we take most of our x-rays on the extraoral machine. And then when we can't see something definitively, then we revert to the 3D machine. I'd like to update you on the patient we just discussed. The sinus infection was taken care of, and they ended up at the specialist that we recommended. They took the time to listen, evaluate, and diagnose, and then found an untreated or an unfilled canal. They went back in and treated that. Patient returned to us, and they're now symptom-free and very happy with the outcome. Well, I hope this information helped. If you like this video, hit that thumbs up button, subscribe if you haven't already, and we'll see you next Friday.